Hey everyone, and welcome to our project on Tourette syndrome. My name is Anna, and my other group members are Brian, Christina, Kyra, Alexa, Valentina, and Laurent. So today we're first going to be talking about the background around Tourette syndrome. So what is Tourette syndrome? What are some symptoms associated with it, and how relevant is it around the world? Second, we'll talk about relevance to dentistry. Why, as a dentist, should I know about Tourette syndrome? And what can I do as a dentist to make treating these patients a little bit easier? Third, we're going to talk about some misperceptions. Are there any stigmas associated with Tourette syndrome? And lastly, we'll talk about some treatment. Some background. Tourette's disorder is a disorder that negatively affects the brain. The exact causes for Tourette syndrome is unknown, but it has been proposed that it may be associated with problems in nervous cell communication. So this includes abnormalities in neurotransmitters. Brain areas dedicated to voluntary movements are especially affected, and we'll see more about this in their symptoms. So before we jump into all the details, let's talk about the relevance of this syndrome. 135,000 children ages 6 to 17 years old have been diagnosed with Tourette syndrome between 2016 and 2017 in the United States. Next, 0.6% or 1 out of 162 children have Tourette syndrome. And lastly, 86% of people diagnosed with Tourette syndrome have also been diagnosed with one or more additional developmental conditions. So as we can see, this syndrome is a lot more relevant than one may think, and it's important as a dentist to be able to know how to interact with these patients. And now on to Alexa, who's going to talk about symptoms.
Tourette's disorder is a pretty recognizable disease. It's characterized by having tics, and these tics can come in a variety of different ways, and they range in severity as well. They can be simple or complex depending on how bad that they get. A muscular tic is when it affects different muscle groups. A simple muscular tic would be affecting one muscle group, and a complex would be affecting many. And this can be eye blinking, jerking of the limbs, or grimacing of the face. And there's also vocal tics, which are pretty recognizable. They can be words, phrases. There's usually repetition of those, and they can even be curse words, although this is not the majority of those with tics have curse word tics. There's many symptoms of the disorder, and it affects a lot of someone's life. One being behavioral. There's compulsive behavior and impulsivity associated with the disease. And it also affects one's mood. Those with Tourette's often have anxiety, which can be pretty taxing on their mental health. They can also have a learning disability, although it's not related to their intelligence. It's their tics get in the way of being able to read and write and perform well in school. And they can also be muscular, as I described before, with the difficulty moving. There can be tensing or just interference with not being able to control your body. And there's often comorbidities associated with having Tourette's disorder. The three being ADHD, OCD, and depression. There's several more, but these are the main ones that often are linked. ADHD is hyperactivity and attentiveness, and this is associated with the learning disability in school. There's also OCD, obsessions and compulsions, leading to or from intrusive thoughts. And this can be a way for those with Tourette's to control the environment around them, and is a direct effect of having Tourette's. And depression is multifactorial. They're not sure if it's a biological cause and effect or if it's the condition that leads to the person having depression. And it depends in each case, in each patient. But depression is just low levels of mood.
So we know that patients that are living with Tourette's syndrome experience both motor and phonetic tics. These tics may cause destructive oral lesions. Patients also living with TS may experience hyposalivation. This is due to the medications that they currently use, and we know that hyposalivation can put them at a higher risk for dental caries or periodontal disease. Also, due to the motor tics, patients may also experience bruxism, which is excessive grinding or clenching of the teeth, which this can cause even more decay of the teeth for the patient. However, good news is that Orthotic devices that are usually treated with TMJ treatment might be effective in reducing tics when worn in the mouth of individuals with Tourette syndrome. And so a study was done in Japan to investigate whether or not an oral splint that's used for TMJ disorders, clinching and bruxism may be effective to ameliorate TS-related tics. And so this device is supposed to help relax and balance the jaw joints and muscles. And the results in the studies showed that biting the device successfully and immediately produced therapeutic effects on motor and phonetic tics in 2/3 of TS patients that were in the study. So this device could actually do really well with TS patients. And so we know that some of the conditions that I spoke about before, like hyposalivation, may exist due to the medications that are being used. We know that bruxism and the oral lesions can be caused by their involuntary motor tics, which can cause more harm to the mouth. Also, we know that motor tics may be a challenge when treating patients with TS, and due to this, they are more likely to be sedated when getting treatment. And some dentists may find it challenging to treat patients with TS due to the motor tics, and this can cause them to involuntarily move while in a procedure. And so this also can cause patients to get anxiety about the dentist and maybe not come regularly. So overall, patients living with Tourette syndrome may have poor oral hygiene or oral care due to the symptoms of TS or medications trying to treat the symptoms of TS. However, current research may also provide dental treatment that may help patients living with Tourette syndrome to decrease motor tics.
Hello, my name is Lawrence, and I will be talking about misperceptions and assumptions about Tourette's disorder. Many of these misperceptions come from the level of intelligence, the concentration, and the working memory of these individuals. However, I will focus on four of the most common misperceptions among society. First, people with Tourette's disorder cannot lead normal lives. Although Tourette's disorder can have a negative impact on some of the affected individuals' lifestyle, many of them do have very fulfilling lives. Having Tourette syndrome has not stopped people from becoming musicians, doctors, athletes, and many more distinguished professions. People with Tourette's disorder suffer from mental illness. Although there's some correlation among people with Tourette syndrome and mental illnesses, there's not causation linking these two. Like any other syndrome, it may occur along with psychiatric conditions such as anxiety, obsessive compulsive disorder, etc. Tourette's disorder is caused by stress or an unhappy childhood. The precise cause of Tourette's disorder is still unknown. However, there's some correlation associated with stress and this disorder. There's no factual data that links it to an unhappy childhood. Current studies seem to lead towards a significant genetic component more so than environmental factors. And lastly, people with Tourette's disorder can control their movements and sounds if they really wanted to. So the movements and sounds associated with Tourette's syndrome are involuntary and uncontrollable that result from altered brain function, according to recent research. So basically, these individuals have different physical and behavioral characteristics that makes them stand out from the norm, experiencing stigma for their differences. And those are basically the motor and vocal tics that leads to societal rejection. And basically this societal rejection, it all comes from lack of knowledge. The non-scientific community doesn't really know about this syndrome and the tics and vocal and motor tics related to it. So this lack of knowledge, it's mainly what leads to the stigma. So the fact is that these individuals will try to mask their tics, which increases their anxiety levels and worsens the syndrome, which at the same time increases societal rejection. So our challenge is to decrease the level of stigma around Tourette's disorder. And how do we do that? Basically by self-advocacy. We have to target education. We have to tailor therapy for young Tourette syndrome patients and behavioral innovations. All of this is basically what will decrease the level of stigma and societal rejection generated towards Tourette syndrome and many other syndromes. Thank you.
Hi, everyone. This is Brian here. I'm going to be talking to you about some issues that can arise during dental treatment with Tourette syndrome. So some things that come to mind are just how the movements are going to be potentially injuring the patient or the staff while working with them. They can possibly damage soft tissue by the sharp instruments, potentially healthy tooth structure using a handpiece. And while working with restorations, the quality of the restorations is going to be affected if there's any abrupt movement that occurs while placing them. It's also recommended that the dentist consult with the patient's neurologist or psychiatrist before treatment. Some of the medications that they're prescribed may have adverse interactions and could potentially be fatal. Not only that, the stress of the dental treatment could worsen their condition and make their tics more severe. And so the staff should just adjust as needed based on how the patient comes in. So some things you can do to reduce their stress is just recognize the problem with the staff and provide an accepting environment for this patient. You can divide the procedure into smaller segments, and also just allowing the patient to get up from their chair, walk around once or twice just to reduce the tension and just helps them from the stress they have just because they're urged to suppress their tics. So it's going to make them a little bit more comfortable. Other means of controlling their tic level is just sedation. That's the most common and most effective technique proven right now. Just to completely avoid any potential risk of injury from unwanted movements. So things that people use or that dentists use are anti-anxiety medication, nitrous oxide, or IV sedation. Anything that causes a partial loss of consciousness or complete loss of consciousness, this is just going to control those movements and just reduce the risk of injury to the patient and provider greatly. So as far as post-treatment with oral hygiene management, you'll want to educate the patient on proper brushing and flossing techniques and be aware of some accommodation that they may need according to their particular tic. But also you want to make sure that they're maximizing plaque removal while performing it this way. Another thing is prescribing salivary stimulation products. Just because of their medications they may be prescribed, will aid in any sort of dry mouth that they have and end up, reducing any risk of caries or any other dental diseases.
So now that you've learned a bit more about Tourette's, we're just going to summarize some of the information that was presented today. So just as a reminder, this condition involves the nervous system, and there really isn't a known cause or a known cure. But with treatment, these people can still lead a normal life.
And as we discussed earlier, some symptoms include muscular tics, such as blinking, eye rolling, and in general, uncontrollable repetitive movements. It's important to remember that there are many other symptoms also associated, such as impulsive behavior, learning disabilities, and anxiety. Although not all of these patients will experience the same symptoms, their treatment can be tailored to their specific needs.
And bringing it back home, Tourette's heavily influences the way that the patient is treated in the dental chair. These muscular tics can actually make it a bit more dangerous for these individuals while they're getting treatment. And these medications can also cause adverse reactions. Any medication that you would normally prescribe a patient wouldn't be the same for someone dealing with Tourette's. And then taking a look at some of the misperceptions, The majority of these misperceptions generally assume that these individuals can't live a normal life, which is not true. And some people even believe that Tourette's is something that can be voluntarily controlled, which is again not true. They really can't control it. It just comes out of nowhere, and it's something that you need to be aware of. And then this judgment honestly can just increase their anxiety and can worsen their tics, which can just make it more dangerous for everyone involved.
And in regards to implications for treatment, it's important to keep in mind that the symptoms associated with Tourette's will interfere with dental procedures. Providing safe and effective care is our ultimate goal and what we strive to do. It's essential that dental providers know how to best treat these patients to make them feel safe and comfortable throughout the entire procedure. And lastly, as healthcare professionals, we should be aware of the many conditions, including Tourette syndrome, that can affect dental treatment. Having a better understanding of these illnesses will allow us to communicate better with our patients and overall provide the highest quality of dental care.
These were the references that we used for our presentation, and thank you so much for taking the time to listen to our presentation and learn a little bit more about Tourette's.